why should I spend money doing fillings on baby teeth when they're just going to fall out anyway? That's a really valid question because we all know that baby teeth fall out and we get a new set, and seems like we kind of didn't even need the baby teeth. The baby teeth do many things for a child, where we do value keeping them and treating those teeth with cavities. So one of the main things that we don't think about that's obvious is that they actually hold a space for the grown-up teeth. So while the baby tooth is still in the mouth, the grown-up tooth is forming up underneath it, and when the baby tooth is ready to come out, there's enough space for that grown-up tooth to come in usually. But if a baby tooth is lost sooner than it should be from decay or something like that, then the teeth actually visually start shifting and crowding, and sometimes there's not enough room for the grown-up tooth to come in, or when it comes in, it's very crowded. So when we're talking about saving money, as we always have to be prudent with daily living costs, especially healthcare costs, which can become pretty overwhelming, we do need to think about the money that we're saving by preventing your child from having braces later, or if they're going to need braces anyway, preventing them from being in braces for so long. So that can really shorten the time period. Another thing, of course, that baby teeth can do is, of course, kids can eat well with them. So if they have a hole or tooth where food keeps getting caught, or an abscess from a deep cavity, that can really cause the child to not eat as well and affect their nutrition. And another thing which matters is that children's confidence as they're going into school and hanging out with their friends. Kids sometimes don't mean to be mean, and sometimes they do mean to be mean, but they'll say things to their classmates, and if someone's got a tooth that's black, or missing a tooth maybe where they shouldn't be yet, then that can affect a child's confidence. But I think in general the main reason is we want to make sure that that space is held for the grown-up teeth. That can be pretty critical. One last thing that we don't think about when we think about what is in the baby teeth and what they do for us is the baby teeth, if they have a cavity in them, that can actually affect the grown-up teeth. So if they have half baby teeth, have grown-up teeth in their mouth, they're kind of in the mixed stage, then those bacteria are more likely to infect a grown-up tooth, which of course you don't get another set of those, so that's really important. So.